Good morning, everyone. I'm Josh Devine from the Tennessee Bureau of Investigation. I want to thank you so much for joining us for this news conference as we discuss some issues around counterfeit pills, valuable resources that exist in the community for those who might be struggling with addiction-related issues. We have a panel of speakers, including Director David Rausch from the TBI, Commissioner Dr. Lisa Pierce, President Agent in Charge for the Drug Enforcement Administration, and Tommy Farmer, who is a TBI Special Agent in Charge and oversees the Tennessee Dangerous Drugs Task Force. Each of these speakers will go one right after the other, and then we'd be pleased to open it up for questions and answers.
Being here with us this morning to have this conversation on this very serious and an important topic. Sound the alarm once again about the dangers of drug addiction. Well, let's show you some examples. Counterfeit pills are a troubling number of cases. They contain fentanyl. On the left is a legitimate oxycodone pill. Legitimate pill on the left, and a fake side by side on the right. Hard to tell the difference, isn't it? Anecdotally, our and instead contain fentanyl. If you're unaware, fentanyl is a synthetic opioid. Some of them deadly. So let me be clear. If you're buying pills on the street in our state, you're gambling. Killing off their customers who happen to overdose. Another possibility is that adversarial nation-state actors as we address this issue, and we must do something to stop it. Stopping it starts with targeting demand. And that requires those who battle addiction, or those who know someone who does, to take the right steps right now that just might save a life. This is Dr. Pierce.
Thank you, Director Rausch. Glad to be here with you today. You know, you typically hear me talk about deaths related to the COVID-19 pandemic and infections from COVID-19. But I want to talk to you today about another epidemic that's causing the death of too many Tennesseans. Drugs. In 2020, we lost 3,032 Tennesseans to deadly overdoses, and that is an alarming 45% increase from 2019 to 2020. That even exceeds the national increase of 30% in the same time period. So in addition to our work with the Tennessee Bureau of Investigation and our colleagues at the Department of Mental Health and Substance Abuse Services, the Department of Health provides support and resources to local communities, particularly in our 5 high-impact areas, using evidence-based public health interventions. Things like overdose outbreak response plans, what we can do to prevent and stop them. Also, drug use prevention education campaigns, medication-assisted treatment programs, and importantly, cross-sector collaboration through county health councils. As a physician, I want to remind Tennesseans, one pill can kill. Do not take pills that were not. There are recovery services all across this state and people waiting to help you and waiting to help you get into recovery. To tell you more about that, I'll turn it over to my colleague at the Department of Mental Health and Substance Abuse Services, Commissioner Marie Williams.
Thanks so much, Commissioner Piercy and Director Roush. Really grateful for your partnership on this important issue and so many other issues. We're here today to talk about the specific issues that you have heard on counterfeit pills, which are dangerous and deadly. But what's clear, what we've known for a long time, is our state doesn't just have a counterfeit pill problem, or an opioid problem, or a methamphetamine problem. We have an addiction problem, just like every other state in this country. If you're hearing this today and you're an active person in active addiction, I want you to know this, as Commissioner Piercy said, there is hope. There is hope in a new life and recovery. We know treatment works, no matter where you are in life, even if you think you've burned every bridge. There are people, 889-9789. Again, that number is 1-800-889-9789. Throughout this pandemic, there are amazing treatment providers, prevention coalitions, as well as many more groups that we fund across this state, have done a tremendous job at adapting to this ever-changing environment. We've made the most of telehealth options as well as treatment options, and continue to try to save the lives of individuals who are struggling with addiction. Specifically on this issue of prescription pills, we have been successful in
said after overdose. There is naloxone. We have regional overdose prevention specialists all over Tennessee. You can go to tn.gov and find a regional overdose prevention specialist near you. You also can text SAVE to 30678. Again, text SAVE to 30678 to download the TN Recovery app, which connect individuals within the community who are struggling with substance use disorder and family members to find resources as well. This is a daily crisis. It's something that we should all take serious. But again, please get trained in how to administer naloxone. Also, carry naloxone in order to save a life. I will leave you with this. Naloxone is one of those things you'd rather have it and not need it than to need it and not have it. Thank you.
Thank Director Roush and our partner standing beside me here today. Their part TBI is proud to be part of the team that is standing here today. Last year in America, over 93,000 people died as a result of a drug overdose. And the primary driver of those overdoses was fentanyl. Fentanyl, a deadly synthetic opioid, is 50 times more potent than heroin, and 2 milligrams is considered lethal, which is small enough to fit on a tip of a pencil. Over the past year, the DEA has seen an unprecedented amount of counterfeit pills containing fentanyl in our communities and has seized record amounts of these pills during enforcement operations. This year alone, DEA and our law enforcement partners have seized over 9 million and why we are here today. Most disturbing, 4 out of every 10 seized counterfeit pills analyzed at DEA laboratories contain a lethal dosage of fentanyl, which is only 2 milligrams. These pills mimic the color, shape, and markings of popular pharmaceutical drugs like Oxycontin, Percocet, Vicodin, Xanax, and Adderall, which can fool the user into believing they are from a regulated pharmacy in the United States. But in fact, these counterfeit pills are produced in makeshift laboratories, primarily in Mexico, by violent drug traffickers with ingredients and chemicals from China. As an example of the magnitude of this problem, during the months of August and September of this year, DEA conducted nationwide enforcement operations targeting fentanyl and counterfeit pill traffickers and seized 1.8 million counterfeit pills and arrested over 800 drug traffickers. To put it simply, these pills are widely available in traditional methods. They target every age, race, and gender. They are using fake pills to exploit the opioid crisis and prescription drug misuse in the United States. I will close by saying, if a friend or relative offers you a pill, don't take it. If you don't receive it from a pharmacy through your doctor, don't take it. You are truly taking a huge risk, and the consequences could be deadly. For more information about DEA's now I'll turn it over to Special Agent in charge for TBI, Thomas Farmer.
Good morning. Thank you very much. I just want to do a couple of and director also talked about with DEA, talking about the importance of that, the partnership. The partnerships are incredibly important, and we can't do, whether it's identifying the sources quickly, rapidly, so that we can respond into the community, or if it's a matter of conducting training, training that we have to conduct for our employees and to keep all of our agents and our law enforcement safe, to carrying life-saving naloxone. It's not only the individuals out there that may be suffering from addiction disorder issues that may need naloxone or access to it, but it's also important for law enforcement now in this day and time to have direct access to naloxone as well. And I can tell you, we've witnessed it. It has saved not only a number of individuals' lives. We know that with law enforcement, and thanks to mental health for making it available to us and getting it out there, and we work on a weekly basis with the ropes folks. They are fantastic. When we see agencies that need access to naloxone or into a community, getting that education, getting that awareness out there directly to them. But I can tell you, from firsthand experience, seeing law enforcement, seeing the life-saving effects of it, we know that over half, and it's growing each year, that law enforcement has access to naloxone, especially frontline first responders. When they have access and they do make it out, that they're most likely the first responder to arrive on scene if it's an overdose. And when they do, we know that about 82% of those, when law enforcement is armed with naloxone, it results in a save. Now, that's a great thing, and it does save those lives. We also realize that it's not something to make someone think, give them the false hope that they should continue. It's an opportunity to direct them to the resources that are available to them. We want them to go into treatment. We want them, and they don't need to get a false sense that somebody's going to be there automatically to save them. What we can say is more and more naloxone, because as the drugs like fentanyl and what's been described here and witnessed here, as those drugs become more and more powerful, it requires more and more naloxone in order to stabilize the person so that until EMS and those individuals can get there. So it's incredibly important. I can tell you right now, working with our partners with DEA, we didn't plan it this way, but right now at the Tennessee Fire Academy, we are conducting training for state and local law enforcement to be able to go out and investigate for the inhalation, absorption issues related to, and then of course the incredible toxicity and potency of fentanyl, where it literally takes just a very, very, very microscopic amount in order to kill you. We're doing that training to prepare those law enforcement to go in, to be able to investigate these crimes, but to investigate it safely. Because if they could be another victim as they're coming in to save somebody else's life. We did bring some items over. It's just a new day. It's what we have to wear. It's what we have to do in order to safely investigate these type of crimes. But it also gives us the ability, some of the new technologies that we have at our disposal that brings the identification, because many of these analogs to fentanyl are incredibly difficult to identify, especially into the field. And so more and more technology and equipment is becoming available for us so that we can bring those, rapidly identify what we're dealing with, what we know, and we're developing ways, and the technology has given us ways that we can identify it, link it to an individual without actually opening up the bag and exposing more and more individuals. So I would encourage you to take a look at that, to the personal protective equipment, and then also you'll see, as I was mentioning just a minute ago, one of the most important things that law enforcement is going to be on recent events. Within the last 7 days, we assisted a law enforcement agency in Tennessee execute a search warrant, and the individual, when they entered the bedroom, he tore the bag, suspected fentanyl. We had 2 overdoses already related to the individual. He tore the bag and he threw the bag at law enforcement. That was one example. Another example at about 9 days ago where we assisted an agency trying to identify the reason or source or why, answer the why is to a child, 2 children overdosed. But they were responsive to Narcan. Thank goodness that they had Narcan. But with some of the technology and devices that we have at our disposal now, we were not only able to identify what the substance was, but where, and take that sample from those children. So thank you very much. I'll turn it back over. I appreciate you guys helping us get this message out.
Tommy, thank you, and thank you to all of our speakers. We'll open it up for questions at this point, and if it's your area, feel free to take a swing at it.
Hello, I don't know who would be best to answer this, but I'm just trying to figure out, and I know this is an issue throughout the entire state, but I didn't know if the drugs, specifically the counterfeit ones, are more prevalent in a certain area in Tennessee, certain counties, certain cities. Just trying to let our viewers know where this problem is really, really bad.
Yeah, so pretty much it is, it's statewide. I mean, there's not an area that is more prevalent. Our investigations obviously are statewide, and we're engaged in these investigations with our partners in the DEA as well as local law enforcement throughout the state. And so I would hesitate to say that there's one place more prevalent, just because the reality is they're being shipped everywhere. And so every community has the potential of seeing these show up in their neighborhood. It's you heard the numbers from the DEA, right, in terms of the number of appeals that are being taken out. You multiply that exponentially, quite frankly, and that's what we're facing. The supply is large, and so when you think about basic economics, right, and so you talk about the supply and demand that goes with basic economics to address this demand side, and that means helping those who are suffering from the throes of addiction, and so I think that's critical. That's a critical piece of this message, is understanding that those who are bringing these drugs into our country, those who are bringing these drugs into our communities, are they're doing it again, as I mentioned, two separate reasons, I believe. One obviously is the profit, but I think there's a nefarious actor in this game as well. And that information is been verified, that there is this other that needs to be as people need to be aware of that as much as they are aware of the other. And so it is not there's not an urban center that this is more prevalent. There's not a suburban center or a rural center that this is more prevalent. It's everywhere, everywhere throughout our state. And I think those numbers play out when we look at our overdose charts. There are obviously heat spots on the map, but the reality is this is hitting every community.
Thank you, that was a great answer, I appreciate it.
Certainly.
Director Roush, what's that nefarious actor you were talking about earlier? You mentioned that nation state maybe intentionally using these drugs to pull Americans. Have you seen evidence of that in Tennessee, and can you speak to all of that?
Yeah, so absolutely. So we know, especially fentanyl and its derivatives, right? We know that the vast majority of the illegal fentanyl that is entering our country is coming from nation-state actors in China that are partnering with the cartel in Mexico and other southern countries, and we have direct evidence in investigations that we have done that puts that together, and we have taken down some of those organizations in our operations. And so, yes, we have direct understanding and knowledge that that's a real threat to our country. And so And we're just a small piece of that. As I have this conversation with my peers throughout the country, we're hearing the same thing. They're finding the same issue.
Anyone else? Sure.
For Dr. Piercy, you mentioned that the Department of Health is looking into what causes overdose outbreaks. Could you go into a little bit on what those factors would be that they're looking into?
Sure, yeah. It's actually not dissimilar to somewhat of a contact tracing approach. So when you find a rash, if you will, whether it's 2 or 3 or 5 overdoses in a particular area, that's considered an outbreak. And much like we do with infections, we start to trace back where it came from. Obviously, it's a little bit or quite a bit more difficult in this scenario, but oftentimes that comes from what we call a bad batch. And particularly during the and part of that was from an adulterated supply driven by continued demand, but those disrupted supply conditions. So when we see a rash of overdose deaths, we sort of take it just like an outbreak of infections and try to find the root cause so we can stop it at the beginning.
Anything else?
Let me add to that as addressing the overdose issue. Historically, we've addressed it as either natural or a natural death or an accidental death is what they've been classified as. In the past 5 to 10 years, we've seen a shift for law enforcement, and that is a focus on investigating overdoses to determine who the actors are that provided that drug to the individual that overdosed. And specifically in those that result in death. And so we have a number of task forces throughout the state that does just that. They investigate overdose deaths, and their purpose is to determine who is providing that drug that caused that death, but it goes further than that. Then we dig into who's supplying that person who provided it. And that has led us to a number of these investigations, as I mentioned earlier. So that's led us to that type of insight and understanding. And so we do that in coordination, again, with the DEA, with our local agencies, through the HIDA program, the High Intensity Drug Trafficking agencies, program through the Office of National Drug Control Policy. And so that is another big piece of what we do, and that's where a lot of this information comes from as well, is from those efforts.
All right. Well, thank you so much. You guys can go ahead and leave the room and we'll kind of clean things up. I do want to let you know, if you didn't get grid shots of those pills in the PowerPoint, if you would, there's a media advisory right here on this second table. If you'll just flip that over. And write your email address where you want me to email those to you, and I'll get those sent to you as soon as we wrap up here today. Right here, this guy has, yeah.
Oh, write it on the back.
On the back of that, yeah.
You want it to your email?
Yes, please. Or just write your email address.